Hello dear aspirants, dear students, welcome to Ganesh Nursing Academy once again. I have started discussing about important MCQs on ECG. I have already discussed about 14 questions on ECG. Okay, I hope those questions will be beneficial for you in cracking the competitive examinations. I request all of you, please watch my video from beginning to end, and comment if you have any doubts. Okay, and you also press the like button, subscribe. Okay, so that will boost me, motivate me. Okay, so that I can prepare more content for you, more important contents for you. So now let's begin with the next questions. Question number 15. Which of the following is an important characteristic feature of a first degree UV block or a first degree heart block? And options are: option A, prolonged PR interval; option B, missing of QRS complex; option C, overlapping of P wave and QRS complex; and option D is a widened QRS complex. Okay. See what happens here. We have mainly three heart blocks are there. Okay, heart blocks are classified into first degree, second degree, and third degree. Okay, so these are the classification of heart block. Okay, or atrioventricular block. What is atrioventricular block? Atrioventricular block means, so this is a heart. Okay, so this is a atrium, right atrium, left atrium, right ventricle, left ventricle. So here there is a blockage of transmission of impulses. Okay, there is a blockage of transmission of impulse from SA node to AV node, SA node to AV node, or there is a blockage of electrical impulse transmission from atrium to the ventricles. So this is known as atrioventricular block or a heart block. So we can classify atrioventricular block or heart block into three types. That is a first degree, second degree, and third degree heart block. Okay. So what are the characteristic feature of first, second, and third degree heart block? So in first degree heart block, what I can say, in first degree, you can see there will be normal P wave, but QRS complex will appear late after the P wave, and there will be T wave. Okay. T wave. Okay. Then again see here, P wave, QRS complex, and there is a T wave. Okay. So what happens here? This is P, Q, R, S, T. P, Q, R, S, T. So what happens here? After the appearance of P wave, to appear the QRS complex, there is a wide gap. There is a wide delay happens from appearance of P wave to the appearance of QRS complex. Same thing is happened here. Okay. Why there is a delay in appearance of QRS complex after the P wave? It is because what happens here? This is a heart, and here we have a SA node, and here we have a AV node. So because here what happens here, there is a delay in transmission. Okay, AV node is unable. Here AV node is unable to catch the electrical impulse from the SA node and transmit it to the bundle office. It takes more time. AV node takes more time to receive the electrical impulse from the SA node to AV node. So because of this, what happens here, there will be appearance of, so first PU will be appear normally. There is no problem with the appearance of PU. But QRS complex appears late. It is because of AV node delay. So AV node makes a delay in catching the electrical impulse from SA node and transmit it to the bundle office. So because of this delay, what happens here, the QRS complex will appear late after the PU. So that is the reason why the PR interval here, PR interval in a first degree UV block. So there is a delay. Say when we check how to check the PR interval. So we will count. We will just mark the beginning of P wave and mark the beginning of Q wave. Okay. Then we count the number of small box. Okay. Suppose number of small box is 5. 5 into 0.04. Okay. So that is 0.20. So like this, Here normal PR interval is 0.12 second to 0.20 second. In this first degree AV block, it is more than the 0.20 second. Okay, it is more than the 0.20 second. You can see there is a 6 or 7 box. Okay, so suppose there is 7 box, 7 into 0.04, it is 0.28 second. So prolonged PR interval is one of the important characteristics of first degree AV block. So this is the right option here. It is the right option. Now let us see what is the missing of QRS complex. Okay. So what is the important characteristic feature of a first degree AV block? It is a prolonged PR interval. Why there is a prolonged PR interval? It is because of there is a delay in transmission of electrical impulses from SA node to AV node. Now what is this missing of QRS complex? Okay. So this missing of QRS complex we see in the second degree AV block, okay. So what happens in this one here? There will be P wave will be there, okay. Then there will be prolonged QRS. This one QRS complex will be there. P wave. There may be PR interval may be prolonged, and after that here there is a P wave, but it is not at all followed by QRS complex. QRS complex is completely absent here. Absence of QRS complex. Then again you can see there is a P wave, there may be QRS complex, okay. So again P wave, there may be absence of QRS complex, okay. So here there is an absence of QRS complex. So absence of QRS complex, okay, or missing of QRS complex. It is an important characteristic feature of second degree AV block, okay. Why there is absence of QRS complex, okay? Why there is a missing of QRS complex in the ECG step? It is because, see here, this is our heart, this is a septum, here is superior vena cava, here we have a SA node, here we have AV node. SA node produces electrical impulses, okay, and this is SA node, this is a AV node. So here in case of second degree AV block, okay, there is a missing of QRS complex. Why there is a missing of QRS complex? Because here the AV node is so weak that it is unable to receive electrical impulses and transmit it to the bundle of phase. Okay, so this P wave is formed. Okay, first there is a formation of P wave. This P wave will be formed because of there is a normal SA node activity, and because of this AV node is unable to carry the impulses, there is a absence of QRS complex, and then again there is a P wave, then QRS complex, then P wave. Okay, so here the P wave is QRS complex is completely absent. Okay, because why the QRS complex is absent here? Because AV node is not able to transmit the electrical impulses from SA node to bundle of phase. Okay, after transmit the electrical impulse from SA node to bundle of phase, then if the impulses spread to the Purkinje fibers, then only the QRS complex will appear. So because of failure of AV node to carry the impulses and transmit the impulses to the bundle of phase, there is no formation of QRS complex. So QRS complex is completely missing in between. So this is the important characteristic feature of a second degree AV block. Okay. Now what happens in third degree AV block? Okay. Third degree AV block. Okay. Missing of QRS complex we can see in the second degree. Okay, it is seen in the second degree. Okay. Now third degree AV block, what happens here? There is a, see here P wave. Okay, the QRS complex may appear soon after the P wave, or here P wave is there, and here only the QRS complex. Okay, you cannot see the P wave itself. There is a QRS complex only. Then you can see there is a P wave. Okay, late after P wave there is maybe QRS complex. Okay, so P wave, Q R S T. Okay, here P wave is completely merged. Okay, it is merged into the or overlapping of Q wave and QRS complex and P wave, and this is P wave. Here is P wave, QRS complex. Okay, and you can see here QRS complex is appeared late after the P wave. So this is important characteristics of a third degree AV block. In third degree AV block, there is no coordination between the atrial activity and ventricular activity. So atrial is contracting and conducting the impulses independently, and ventricles are contracting and conducting impulses independently. Those, there is no coordination between the atrial activity and ventricular activity. Okay. So because of this, there may be overlapping of P wave and QRS complex. Okay. So see here. This is right atrium, left atrium, right ventricle, left ventricle, superior vena cava, SA node, SA node. This is AV node. Usually, normally what happens here? First, the SA node produces electric impulses at the beginner. Okay. Then after that, the impulses will be conducted by both atrial chamber, and then what happens here? PAV will appear. Okay. Then after that, electrical impulses is conducted from atrium to the ventricles by receiving the electrical impulse from SA node to AV node. Then the impulses are conducted to the bundle of his. Okay. Then impulse is conducted to by the Purkinje fibers. Okay, Purkinje fibers. Then what happens here? QRS complex will appear. Okay, QRS complex will appear, and then T wave will appear after the ventricular depolarization. Okay, so this is a coordinated activity. This entire electrical activity in heart is coordinated activity. So first there will be atrial activity followed by ventricular activity. Okay, followed by relaxation ventricle. So this activity is a coordinated activity. But here, because of this third degree AV block, there is no proper transmission of electrical impulse from atrium to the ventricle. What happens here? Atrium will, the conduction and contraction of atrium and conduction of electrical impulses and contraction will happen independently. That will take place independently. So because of this, there is no, okay, like a P wave will not, like QRS complex will not followed by P wave. It is not like that. There may be overlapping of P wave and QRS complex, or QRS complex may appear late after the P wave. Okay, or sometimes what happens, QRS complex appear very near to the P wave, or sometimes P wave may be merged into the QRS complex. So all these things we can see in the third degree, okay, AV block. It is also known as complete heart block. Okay, so this overlapping of P wave and QRS complex, it is an important characteristic feature of a third degree AV block, or it is also known as complete heart block. It is also known as complete heart block. Okay, and last, what is this widened QRS complex? Last option. So this widened QRS complex. Okay, see here, this is a these are all QRS complex. QRS. Okay, QRS. Okay, QRS. So these are the widened QRS complex. It is specially seen in ventricular tachycardia. It is the important characteristics. Okay, these are the important characteristics of a ventricular tachycardia. Ventricular tachycardia. If you see widened QRS complex, this is, see, QRS complex is widened, here also widened. Okay, so this widened QRS complex, it is a important characteristic feature of a ventricular tachycardia. Okay, so what is the question here? Question number 15. Which of the following is an important characteristic feature of a first degree AV block? So the important characteristic feature of first degree AV block is a prolonged PR interval. Okay, so prolonged PR interval is the right answer. So mixing of QRS complex is a important characteristic feature of second degree AV block. Overlapping of P wave and QRS complex, it is an important characteristic feature of a second degree AV block. Okay, third degree AV block or complete heart block. And widened QRS complex is an important feature of a ventricular tachycardia. Okay, I hope you understood this concept. Okay, dear students, let's discuss next question. Question number 16. Which of the following arrhythmias is considered as a lethal arrhythmias? Okay, so here first one is, what is the meaning of lethal? Lethal means dangerous. Okay, arrhythmias means already you know that there is an alteration in the rate, rhythm, conduction or configuration. Okay, so after making a note of a lethal, that is a dangerous, we will see the options. Option A, pulseless ventricular tachycardia. Option B, ventricular fibrillation. Option C, ventricular systole. And option D is all of the above. Okay, so first one is pulseless ventricular tachycardia. Okay, What is the pattern of rhythm in pulseless ventricular tachycardia? Okay, so this is a pulseless ventricular tachycardia. I will show it here. So already I have shown you. So this is a pattern of a rhythm in case of ventricular tachycardia. Ventricular tachycardia may be with carotid pulse or absence of carotid pulse. Okay, so if you find this kind of rhythm, okay, that is a broad QRS complex. Okay, see here, this QRS. So there is a broad QRS complex with inverted T wave. This kind of rhythm, if you see in the monitor or in the ECG, so this is known as one of the dangerous arrhythmias. Okay, why? What happens in this condition? Okay, so the heart rate, the pulse rate will be more than 150 here. Okay, pulse rate will be more than 150 per minute. And what is the status of heart? Heart is contracting very little here. Okay, though heart is contracting rapidly, but contracting very little, so that there is no proper output of blood from the ventricle, left ventricle. So because of this, the patient may have sudden loss of consciousness, and there is a sudden cardiac arrest. It may follow. Okay, so that is the reason why pulseless ventricular tachycardia is considered as one of the lethal arrhythmias. It is one of the lethal arrhythmias. Why it is one of the lethal arrhythmias? Because heart is contracting very weakly. Okay, very weak contraction is there, weak and rapid contraction. Okay, but because of this weak and rapid contraction, what happens here? There is no proper cardiac output. There is no proper ejection of blood from the left ventricle, and the peripheral tissue perfusion is severely affected here. So because of this, what happens here? Patient will have a loss of consciousness, collapse of patient, and it is followed by the cardiac arrest. So that is why it is important. And what is the main treatment for this pulseless ventricular tachycardia? Whenever patient is in pulseless ventricular tachycardia, immediately we have to start with a CPR. Okay, basic life support we have to start, and immediately we have to call help. Okay, to bring the defibrillator. Defibrillator and shock is the main treatment for this kind of arrhythmias, ventricular tachycardia, pulseless ventricular tachycardia. Okay, next one is ventricular fibrillation. Okay, yes, this ventricular fibrillation is also considered as one of the lethal arrhythmias. Okay, so there is no particular pattern in the ventricular defibrillation. There is a irregular waves you can see here. Okay, there is a irregular waves you can see, notice in the monitor or when you do an ECG. There is no particular pattern of ECG in the ventricular fibrillation. Okay, and why it is considered as a lethal arrhythmias, a dangerous arrhythmias? Because heart is only shivering here. Okay, heart is only fibrillating. Okay, so heart only fibrillate, and because of only fibrillation, there is no proper ejection of blood from the left ventricle. So there is no proper pumping of blood by the heart. So because of this, there is a decreased peripheral tissue perfusion. Patient will have a loss of consciousness. Patient will collapse, and this arrhythmia is also followed by cardiac arrest. Okay, so that is why it is considered as a ventricular fibrillation is also considered as one of the lethal, that is dangerous arrhythmias. Okay, and when you see the heart rate of the patient, here also the heart rate of patient is more than 150 per minute. Okay, the heart rate will be more than 150 per minute, and here the heart is only shivering. Okay, so this is also considered as one of the serious lethal arrhythmias. Okay, whenever you see this kind of arrhythmias, immediately you have to rush to the patient. Okay, first check the leads, whether there is any disconnection of leads. That can also, disconnected lead also can give rise to this kind of arrhythmias. Okay, check the conscious level of the patient. If patient is not conscious, check the carotid pulse. Carotid pulse is absent, then immediately you have to start with the CPR. Okay, and call for the help to bring the defibrillator. Okay, so this is ventricular fibrillation is also one of the shockable rhythm. It can be terminated by only giving the shock by the defibrillation. Okay, until that we need to keep a chest compression we have to do to maintain the cerebral tissue perfusion, to maintain the vital organ tissue perfusion. Okay, so this is the ventricular fibrillation, which is also considered as one of the dangerous. So this is also dangerous arrhythmias. Pulsar ventricular tachycardia is also dangerous or a lethal arrhythmias. Okay, next one is ventricular asystole. See, ventricular asystole is like a flat line only. Okay, so there is a flat line. Almost the heart is not stopped pumping the blood. Okay, it is like a completely heart has stopped pumping the blood. So there is no output of blood from, there is no ejection of blood from the left ventricle of the heart. So here it is like a condition of a cardiac arrest, where heart is complete, there is no electrical activity in the heart. So this is also considered as one of the lethal arrhythmias. But what is the difference here? We should not give any shock here. Defibrillation is not contraindicated. Okay, when you see the pulse and heart rate will be almost like a zero here. There is no pulse or electrical activity. Okay, but in this systole, we have to maintain this systole. We have to manage this systole with a cardiopulmonary resuscitation. Okay, and no shock is indicated. Okay, so defibrillation shock is indicated in case of pulseless ventricular tachycardia and ventricular fibrillation, but in case of ventricular systole, defibrillator shock is not indicated. Okay, and this is also considered as a lethal arrhythmia because there is no cardiac output, there is no ejection of blood from the left ventricle of the heart, so that is why it's considered as a lethal arrhythmia. Okay, so this is also lethal arrhythmia. So the question that is, which of the following arrhythmias is considered as a lethal arrhythmia? So all these, pulseless ventricular tachycardia, ventricular fibrillation and ventricular systole, all these are considered as a lethal arrhythmias. So option D is a right answer here. This option D is a right option. Okay. Okay, dear aspirants, let's discuss next question. Okay, question number 18. What is the important characteristic feature of right bundle branch block? Okay, RBBB. Okay. Options are option A, prolonged QRS duration, option B, prolonged QT interval, option C, M-shaped QRS complex, option D, all of these above. Okay, all of them. So what happens in right bundle branch block? Okay, so this is a characteristic feature of, okay, what is the key point here? Key point in question is, what is the important characteristic feature of right bundle branch block? They asked a important characteristic feature of right bundle branch block. Okay, now what is the ECG pattern in right bundle branch block? Let's see. There will be P wave will be there, okay, but here the QRS complex will be, it is turned to M shaped, okay, M shaped turn, and then there will be T wave. Okay, so P Q R S T. Okay, so this is a pattern of ECG in the right bundle branch block. Okay, so always right bundle branch block will have a M-shaped QRS complex, and left bundle branch block will have a W-shaped QRS complex. That I will show you. Okay. So what happens here? So because of this M-shaped QRS complex, this QRS duration. Okay. When you count the QRS duration we will count from the beginning of Q wave to the completion of S wave. We count number of small box. Okay. So number of small box, suppose it is 4 into 0.04, that is 0.16 seconds. So it is prolonged QRS duration. Why there is prolonged QRS duration? Because the shape of QRS complex is turned to M shape. So because of there is a widening of a QRS, because of this shape change in the shape, there is a widening of QRS complex, and there will be prolongation of QRS duration. This is a correct. Prolongation of QRS duration is correct option here. And next is prolonged QT interval. Okay. How to calculate the QT interval? So we are calculating the QT interval from, okay, just we have to mark from the beginning of Q wave to the completion of T wave. Beginning of Q wave to the completion of T wave. So we have to count all the number of small box between the beginning of Q wave to completion of T wave. Okay. So we have to, suppose we get a 12 small box. Okay. So 12 into 0.04. So that is 0.48 seconds. So because of prolongation of a QRS duration, QT interval, why is it? Because QRS complex will comes under in between the QT waves. So that is why. So because of prolongation of a QRS complex, because of widening of QRS complex, there is a wide gap is taken place between the from the beginning of Q wave to the completion of T wave. So this will lead to prolongation of QT interval. Okay. So QT interval is also prolonged. So that is also one of the important characteristic feature of a right bundle branch block. Okay. And next one is M-shaped QRS complex. Already I have told you that in case of right bundle branch block, the QRS complex will have a M-shaped. Okay. P wave and T wave, ST segment, everything will be normal. But when you see the QRS complex will be turned into M shape. Okay. So option C, that is M-shaped QRS complex, it is also right option. So the answer for this question is all of the above. Okay. So all these characteristic features are of right bundle branch are prolonged QRS duration, prolonged QT interval, and M-shaped QRS complex. All these are the important characteristic feature of a right bundle branch block. Next question. Okay. Question number 7. Which of the following arrhythmias is a shockable rhythm? Okay. Which of the following arrhythmias is a shockable rhythm? Okay. First one is pulseless ventricular tachycardia, ventricular fibrillation, both A and B, none of the above. So option A, pulseless ventricular tachycardia. Option B, ventricular fibrillation. Option C, both A and B. Option D, none of the above. Okay. So which of the following arrhythmias is a shockable rhythm? Okay. So shockable rhythm mainly when we want to defibrillate. Okay, when we want to defibrillate, there are two shockable rhythms. That is a pulseless ventricular tachycardia and ventricular fibrillation. Okay, so these two rhythms are considered as a shockable rhythm. Okay. So what is the pattern of ECG in pulseless ventricular tachycardia? You can see first I will show the pattern of ECG in pulseless ventricular tachycardia. Okay. So this is a pattern here. So this is a pattern of ECG. You can see in monitor or on taking ECG. Okay, so this is a pattern. If you find this is a pattern, okay, so this is a QRS complex. This is a QRS complex, wide QRS complex, QRS, wide and QRS complex. Okay, so if you find this kind of pattern of ECG and patient pulse rate is more than 150, patient pulse rate is more than 150 per minute. Okay, if you find this kind of rhythm, immediately you have to rush to the patient, check the carotid pulse. If carotid pulse is absent, because when carotid pulse is absent, it is known as pulseless ventricular tachycardia. Okay, so in this condition, immediately you have to arrange for the defibrillator and immediately you have to give shock to terminate this rhythm. Okay, to terminate this rhythm, and until you arrange everything for the shock, you have to keep giving the chest compression. Okay, you have to give the CPR. You have to continue the CPR. Once this shock defibrillator is arranged, you have to give shock. Okay. Next one is ventricular fibrillation. What is the pattern of ECG in ventricular fibrillation? So in case of ventricular fibrillation, okay, I already have told you that there is a irregular wave will be there. Okay, there is no particular pattern. Okay, there is no particular pattern here. Okay, not like any particular pattern. You can see there is a irregular waves. You can see what. Okay, so this kind of rhythm if you find in the monitor, okay, immediately you have to rush to the patient, check the leads whether the leads is been disconnected or not, check the conscious level of the patient. If patient is not conscious, this kind of rhythm is going on in the monitor. Okay, then check the consciousness, check carotid pulse. Okay, carotid pulse is also absent, patient is not conscious. Okay, and this kind of rhythm is running in the monitor, and when you check the okay heart rate of the patient, heart rate is more than 150 per minute. Okay, so immediately you have to start with the chest compressions because heart is only fibrillating here. Heart is only fibrillating. Immediately you have to arrange for a defibrillator machine and you should start giving the CPR. Okay, until the defibrillator is arranged. Okay, so once the defibrillator is arranged, you have to deliver the shock to the patient. Okay, so there is no other treatment for this both ventricular pulseless ventricular tachycardia and ventricular fibrillation. Only the best treatment for these two conditions is a defibrillator. Okay, defibrillation. So we have to give shock. After giving shock only these arrhythmias will be terminated. Okay, but we have to give chest compression before we arrange for the defibrillator machine just to maintain the perfusion of blood to the vital organs. Okay, and next one is option C, that is both A and B. Okay, so both A and B are indicated for a defibrillation. That is both A and B are the shockable rhythm. Okay, so answer for this question is the answer C, that is both A and B. So answer D is none of the above, it is the wrong option. So option B, that is both A and B. Both pulseless ventricular tachycardia and ventricular fibrillations are a shockable rhythm which can be treated by only